Hey guys, Dr. Michael Derry here today, and I'm a doctor of physical therapy and I treat sciatica all the time. Let's talk a little bit about sciatica and this very little known treatment called neural dynamics. This can absolutely be a game changer, and when I learned about this and started implementing it in my patients, it was a breakthrough in their pain relief. Neural dynamics can help knock sciatica out of the park, but you just got to know how to do it, and we're going to go over that today. All right guys, quick anatomy lesson. So the lumbar spine and the sciatic nerve are highly integrated. Your sciatic nerve starts in your lumbar spine, comes out of your glutes, and goes down your leg. That's kind of the short version of that. Now, your nervous system, the way the sciatic nerve lives in your body is that it has a neural sheath around it, and around that sheath is basically everything else in your body, like your muscles, tendons, and just stuff it runs through, next to, in between of, all of this stuff. And neural dynamics, this term is like, how does that nerve interact with this moving system of your body, right? When we go to bend over, bend backwards, bend sideways, pick stuff up from the ground, etc., etc. Neural dynamics is a very, very effective treatment, but it's really important knowing what you're doing and what it should feel like. And so we're going to go over that in a little bit about what the neural dynamics looks and feels like when you actually do it on yourself. But I think it's good to know of what's going on here. So when you have your nerve, that neural sheath that sits around it, and you have some sort of stuff going on in your back, whether that be stenosis, disc bulging, you're 60 plus years old, 50 plus years old, 30 plus years old, right? Nervous system just has a little bit of a decrease in space over time. And then sometimes that space can encroach on the nerve, causing a little bit of inflammation. I call it stickiness. And so the nerve just can't move as well as it used to. And so when we want to improve that radiating sciatica type symptoms, we want to improve how that nerve moves and interacts. So nerves need three things. They need space, they need movement, and they need blood flow. And neurodynamics gives the nerve the moment of space, movement, and blood flow to reduce inflammation and thus improve symptoms. And so when we're talking about space, movement, and blood flow, you can see, in your spine, when you go to flex forward, there's a little bit more space, but sometimes with sciatica, when we flex forward from a disc bulge or herniation, you can actually have an increase in symptoms. And so what I notice is that when people have sticky sciatic nerves, they have difficulty bending over and touching their toes, or they have symptoms when they sit for too long. That's key, right? When you sit for too long, you have a little bit of pressure onto that nerve, and that can cause radiating symptoms. But I promise you, when you do the neural dynamics and you do them right, you'll have a relief, but it can take some effort. And so the neural dynamics is a breakthrough treatment in treating sciatica, but you just got to know what you're doing, what it should feel like, and how often to do it. I'm going to put all of that in the description, but when you're treating sciatica, you have that big sciatic nerve, it needs some love, it needs some TLC, so you should try neural dynamics to help improve those symptoms. And so we're going to go over neural dynamics right now. All right, so we're going to go right into neural dynamics / sliders / tensioners and sliders and gliders, neural flossing, whatever you want to call it, but it's in the realm of neural dynamics. And so we're going to learn how to move that sciatic nerve. And so the sciatic nerve is a big, beautiful nerve that starts in your lumbar spine and goes all the way down your leg. And so you could have symptoms anywhere along that path. And this is an often missed treatment in those who have any type of sciatic type symptoms, whether the cause is from stenosis or herniation or disc bulging, etc., etc. But it's for those people that have the radiating discomfort down their leg. And if you have a clinical exam from a physical therapist, we can easily tell you if that's happening or not. But if you're wanting to try some neural dynamics, some sliders and gliders to help improve your leg symptoms, this is a good place to start. And so what we're going to do is we're going to use this really tough nylon strap to help give our leg a break, but help improve the neural dynamics inside the leg in regards to the sciatic nerve. And so we're going to start with looping this around the arch of the foot. And it really doesn't matter. Well, let's do this one down here. So the positioning is key here. And so what I would recommend is no pillow at first, and you want the other leg completely straight, and then the leg that we're focusing on is going to be completely straight. So we're going to start down, and the key is to use one of the loops here with this strap. You never want to increase your symptoms when you do this, but you will feel it, but you should feel better afterwards. And so we never blow past your nerve pain. So I'll show you a couple examples here. So she's going to try to keep her foot in line with her hip, and so her foot's not swung out, it's kind of straight in line. And she's going to pull up with a good amount of tension until she feels her symptoms down her leg. And the number one thing is that if you feel it hamstring and calf, right, the only thing that changes in that goes down that whole pathway is your sciatic nerve. And or if you want to do a little test, you can point your toes a little bit and then pull them down. And if you feel a change in your symptoms into your hamstring, your glute, your back, that there's no muscle that travels that entire pathway. It is your nerve. And so we're gonna go back down. And so this is what it looks like when we treat it, is that we wanna have the client pull up till she feels her symptoms, comes back down. And for some people that may be here, that absolutely is perfectly normal to feel symptoms right there. But 99% of the time, as you keep going, you're gonna be able to go higher and higher without as intense as symptoms, or the symptoms don't go as far down your foot. You should notice some level of improvement. And so it's really neat when we start playing with these neural dynamics and doing this flossing and gliding, is that you'll notice an improvement in back pain, hip pain, leg pain, especially if that sciatic nerve is involved. And so as she continues to do this, I know Clara personally, and she will loosen up. We've done this many, many a times, but when we see this in the clinic, it's a home run because the client has an immediate improvement in symptoms. They feel better. They have an improvement in range of motion. And most importantly, they could do it to themselves, and it's not invasive. There's no risk. It will improve your leg symptoms. Now, the reps and sets and dosage that I normally give are a little higher than normal. And when we think about strengthening and stretching, and I'll put that in the description, it's because those nerves need some love. And so any type of change, like using a pillow underneath your head, will change the nervous system a little bit. And so you're going to want to use this strap, keep the legs super relaxed, and pull into that limitation, and then come out of it. Now, do you have to go all the way down between every rep? No, not at all. You can just pulse with it. And what we say is flirt with it. So on and off, on and off. And since it is a nerve, it kind of should feel like a light switch, like completely on, completely off, completely on, completely off. I know it is boring, but if we were to test your ability to bend over or leg symptoms before and after, I know that it would improve. So using the neural dynamics and nerve flossing can absolutely help with sciatica and sciatica type symptoms, but it's about how you do it, how it feels throughout, and that's why it can be so tricky to treat. And so hopefully this gives you a good place to start. Remember, reps and sets will be in the description. And if you guys have any questions or comments, please leave them. And if you guys could support the channel, that would be awesome too. But until next time, stay healthy, keep moving, and take care of yourself.